Hi everyone, we're gonna try this again. I had some connectivity issues, so I think just popped off there. Hopefully you didn't see me rummaging around. This is our Facebook Live on the Tranquilo channel. So before I get started, can folks hear me? Are folks hearing me? Well, we have a few people tuning in, so I'll give them a moment to actually, comment and let me know that they can hear me. My name is Melissa Gersin. I am the founder and CEO of Tranquilo Mat. I am a maternity nurse as well, so the last few weeks I've been giving you all of my tips and tricks as a maternity nurse. So we've been going through all the 5 S's. We've been learning, all about how to swaddle, how to use we're going to do constant motion and constant sound in 2 weeks' time. Hi, Konita. I hope I'm saying your name right. Thanks for joining us. And we went through side and stomach lying the other week. So again, my name is Melissa Gersin for you guys tuning in. And this week we're going to be talking about using sucking to soothe baby. So if any of y'all have fussy babies out there and you've been enjoying our videos, don't forget to tag some friends or invite them to join the video, because today we're going to go through the how-tos of sucking. So it seems a little bit obvious, I know. Some of you might actually be wondering why we're even going to be talking about this, because babies suck, right? Babies use pacifiers, babies breastfeed, duh. Babies love sucking. No, who is this crazy lady trying to tell me that my baby loves to suck? So the first and most important thing that I want to tell you is why babies enjoy sucking. So babies outside the womb, obviously, their survival depends upon being able to suck. It is actually a reflex when they're born that babies know how to suck and swallow, which is great because can anyone out there imagine trying to actually teach your baby how to suck, right? Like they can't even keep their eyes open. They're like sleeping most of the time. They've got their eyes crossed. They can't coordinate their limbs. They can barely bring their hand to their mouth. They're probably smacking themselves in the face instead. So thank goodness they're born with this sucking reflex. So that's the first thing. Babies have been practicing for a long time in the womb on how to suck. So obviously in the womb, their hands are, most of the time their hands are really up by their face because there's not a lot of room. And so they've got their hands really close by and they're practicing that sucking reflex. And oftentimes they might even be practicing, by sucking their thumb. The problem though, when babies are first born, 0 to 4 months, they have real difficulty actually being able to keep their hands up at their mouths. As I just mentioned, babies when they're first born don't have that kind of coordination where they're able to actually try to bring their hand to their mouth. It's actually pretty much impossible. If you watched a baby probably 24 hours a day, 7 days a week, baby actually being able to get their hands into their mouth and keep it there for more than 30 seconds is you might see it once in the first 4 months of your baby's life, and that's like pure luck because they are wanting to suck all the time. So so that's why babies love to suck and why it works to calm them. So I would love to hear from folks out there as we're getting started, where you're tuning in from and how old your baby is. And if you use anything with your baby to suck. Are you breastfeeding, bottle feeding, pacifier? We're going to go through all these. Even a pacifier, some of you guys out there might have a baby who doesn't like to use a pacifier, and I've got tips for you to get baby to take the pacifier. And if you're one of those mamas who is breastfeeding and doesn't want anything to do with a pacifier, I've also got tips for you because it's great to breastfeed, and I'm sure you don't mind putting your baby to breast often, but maybe 100 times a day might be a little too much for you. So I've got a tip and a way to kind of soothe your baby by using their sucking reflex without using breastfeeding or your nipples. So stay tuned for that, and don't forget to tag friends who might be interested in watching me discuss all of this. So first, I want to kind of describe to you how there's 2 different kinds of sucking. So if a baby is getting food, if they're eating from a bottle or from a breast, then it's called, it's eating for food, it's sucking and eating for food. The other type of sucking that we have is when baby is just soothing, is trying to get themselves soothed and comforted, and that is called non-nutritive sucking. So what we're talking about today is non-nutritive sucking. So baby who wants to be, who just needs some extra little bit of soothing. That's what we're talking about today. babies, does anyone have a guess out there how much babies drink every day? They want to be sucking a lot and often because, as you know, babies grow really, really fast. So babies actually often, or the average, is 3 ounces of milk for every pound that they are per day. So by the time your baby's 4 months old, that's how much they're taking in usually. And that would be the equivalent of an adult having 5 gallons of milk every day. 5 gallons of milk. Can anyone imagine that? I would be like throwing up if I had that much milk right now. So, yeah, so babies want to suck. They want, they want to not only just eat, but oftentimes that actual, just the motion and that reflex of sucking is really, is just really soothing for babies. So that's what we're talking about today. There are actually studies out there that have shown that babies who are sucking, non-nutritive sucking, they're sucking for just to get comfort, that it actually is lowering babies' stress hormones. So it is actually calming them. So if they're just sucking on a pacifier and they're not actually eating, that can be super helpful in decreasing their stress. And it also helps to stimulate natural pain relief chemicals into their brain. So sucking has been used in hospitals for babies. They provide the baby with a pacifier or, with a finger or even mom's breast milk when baby's getting shots. So anyone out there due for their 2 or 4 month shots, great way to keep baby calm either before, during, or after shots is to have them to be sucking, right? To use that reflex to the best of its ability and get those kind of natural pain relief chemicals flowing. So, definitely be using that when you have those shots coming up, because we all know how baby gets after shots. Yeah, and think about, I don't know if any of y'all know adults or older kids who actually, the same concept of why babies are soothed with sucking is actually the same in adults and older children. Anyone have a guess out there as to why or what those kind of activities are? I bet some of you that are watching today are actually use some of these. So any smokers out there? I know smoking also is bad for you and it's got some chemicals. So, obviously, nobody should be smoking, but there's plenty of us that smoke out there, whether it's daily or occasionally. So that, kind of having that something in your mouth with the smoking is linked to that sucking reflex. Anyone who loves to maybe chew gum or like lick lollipops, kind of the same thing. One of the other things too is nail biting. So I don't know if any of you guys are nail biters out there. If I've got a hangnail, I am. I'm going to admit it here right on Facebook Live. You guys probably know more than you need to about me now at this point. But that is based on that sucking reflex. So looks like Kristen likes to bite the inside of her lips. I probably do that too, mostly when I'm concentrating. So, so it's a very innate human, soothing mechanism. So babies love it and we want to use it to get babies soothed. Before we go any further, I do just want to be very, very clear that, sucking and all of these 5 S's that we've been talking about, so swaddling, swaying, constant motion, shushing, which is constant sound. We're going to talk about those last 2 in a few weeks. And we went through side and stomach lying, and today's sucking. This is like cooking. So when you're cooking something, you have multiple ingredients and you don't want to leave anything out, right? You don't want to, you don't want to leave out the salt because it might not taste good. You don't want to leave out the tomato sauce on your pizza if you wanted a classic pizza. So think about it that way, that these types of, all of these are great on their own, but they're even better when you put them together in a recipe for soothing. So just keep that in mind. Hi, Liz. Thanks for joining us today. We also had another gum chewer that admitted that they liked kind of their sucking reflex as well. So thank you everyone for joining me. If you are enjoying the content so far, don't forget to like or tag a friend so that they can see the content that we're putting out there for you guys, so that you guys can have calm and relaxed babies, because mama needs a break. You know what I'm saying? So, couple other interesting sucking facts before we really kind of get into the nitty gritty of it. So studies have found that babies who use pacifiers, who use have non-nutritive sucking, I guess, specifically, I guess this study discussed pacifiers, actually grow faster. So if you guys want your babies to grow and grow big and strong and faster, maybe a pacifier is the secret key to it. So who knew? Also, SIDS, sudden infant death syndrome, is another, you guys have probably all been lectured on it ad nauseum. Baby put them on their backs to sleep, no extra things in their crib, pillows, blankets, none of that stuff, safe for SIDS. Yep, and Silvana just guessed it right. So actually, if babies are using pacifiers, it decreases their risk of SIDS. So that's another great thing that you guys can be using the sucking reflex for. So again, we're going to go through how to get, if your baby doesn't like a pacifier, how to get them to like it and keep it in their mouth. I know that's a struggle for a lot of mamas out there. So another just random interesting fact is that the Greek word gala, G-A-L-A, is actually where we get the term galaxy from. So everyone knows the Milky Way galaxy, right? So actually gala and galaxy is based from the Greek word gala, which is for milk. So next time you guys are all staring at the stars, you can think about breastfeeding and think about sucking and soothing your babies. So just a totally random history of that word that I came across in my research to make sure I was prepared for you guys today. A little bit more on the history of sucking. So in, kind of remote tribes all around the world, you guys might have seen them on like National Geographic. I'm not going to name them because nobody will probably know who they are. But those mamas may be in sub-Saharan Africa, or certainly, there's like some tribes in the highlands of Thailand. They are using their breasts and breastfeeding all day, every day, the minute baby makes a peep as a way to soothe. And they have done studies that those babies can go to breast up to 100 times per day. So I wasn't joking earlier. I mean, I was, but like who has 100, who has the time to have their baby at their breast 100 times in a day? You would never sleep. So I've got tips for you on that. In the past before we actually had synthetic nipples or pacifiers or even bottle nipples, they would the folks back in like the 1900s would end up putting like bread or sugar inside of cloth and then putting it into babies' mouths, and they called it a sugar teat. So that's a very random history. And then if baby were particularly fussy, and I'm sure some of you have heard this trick, maybe you got a grandma out there who says to put the pacifier into brandy, right? So they would dunk this sugar teat that they would make out of cloth and sugar, and they would put it into brandy and then put it into baby's mouth. So while most pediatricians and doctors and nurses won't necessarily recommend ever using brandy for a baby, right? Probably not healthy to give your baby any kind of brandy. But I will say that if baby's being super fussy, pour yourself a brandy, and then maybe you'll feel better about the whole situation. So yeah. And then the other thing was that pacifiers and bottle nipples weren't actually developed until the 1900s. So it's a relatively new. I mean, I know like 1,000 years, or sorry, not 1,000 years, 100 years is a long time. It seems like a long time, but it's not too bad. It's not too long. So just be thankful that we have them these days. So when it comes to pacifiers, there's so many different types of pacifiers. I only have one today with me, but next week when we go through in a few weeks, when we're gonna go through some things live with babies, we're gonna do some swaddling demos again, and the swaying and the shushing. I will try to bring some other kinds of nipples or other kinds of pacifiers. So this type of pacifier is just kind of like a standard pacifier. You can see that it's got kind of the same size like shape on both sides. I don't know if you guys can see that right there. There are some that actually are more flat, so they're not kind of the same. There are some that you might get from the hospital, the green ones, they're the nooks. Those are super common in the hospital these days. Those are longer and they're straight, as opposed to this one's kind of got like a little bit of a bell curve to it. I don't know if you can see. Yeah, there you go. You can kind of see that. So there's so many different types of nipples out there, and you guys probably don't know this because you don't invite your friends over and say, hey, let me look at your nipples, right? I mean, even if you're breastfeeding mamas, you're part of a mom's group, it's not something that you guys talk about. But as a maternity maternity nurse, I've seen a lot of nipples, ladies, and they are all very different. So one thing, to know is that if your baby doesn't like the pacifier, try a different pacifier. There's the orthodontic ones that have, like I said, this kind of like a flat section. They've got longer ones, shorter ones. They've got the, the straight ones. This one's more of a curved one. So you can kind of, maybe just go to the bathroom or just look next time you're breastfeeding and just check out your nipple and be like, what does this look like? And then when you go to the store, try to find a pacifier that's kind of similar. One of the other things that you'll want to note about pacifiers and the difference between pacifiers and the breast is that obviously the feel, and you guys can do this right at home, the feel of your nipple is very different than the feel of kind of this synthetic, often silicone, type of nipple. It's just a very different feel. These are often firmer, and some babies actually find that the firmer either bottle or pacifier nipples are easier for them to suck. And I'll get to that in a second, but it's because it's when it's firmer, it actually activates their sucking reflex, which is done by touching the soft palate in the back of their mouth. So some babies actually find the firmer the better, whereas others really like that soft, more natural, simulating mama type nipple. So keep that in mind. And then the last little thing, when it comes to the difference kind of between breast and nipple, whether it's pacifiers don't have holes in them, right? It's just like a complete silicone pacifier, but bottle nipples do. And if you guys look at kind of bottle nipples, you'll see that they only have maybe 1, 2, maybe a few holes, not that many. There are a few brands out there that are really trying to simulate what the breast is like. But if any of you all breastfed or are still breastfeeding, if you even just hand express a little bit of milk before the start of a feeding, you'll notice that milk is actually coming out of multiple ducts, often like about a dozen small little ducts or holes, or in many ways almost like a pore, and it's coming out of that. So it's a very different type of way to get milk and to get nutrition, right? So some babies, the bottle is actually, if they only have the one hole, it's actually usually bigger and it's a lot more milk can flow. So if you end up holding a bottle upside down and you're holding it kind of like this, you will see just milk drip, drip, drip. So even if you've got a super lazy baby who doesn't really, isn't great at breastfeeding, they might actually take to the bottle better because they're just being super lazy about it and they're just kind of waiting for the milk to dribble into their mouths instead of doing some really proper sucking. So breastfeeding and pacifiers as well as bottle nipples are very different. So try various ones to see which one your baby likes. So that's kind of my first tip. But maybe you guys have already tried that, right? Maybe you haven't gone, and looked at your nipple and then tried to go to the store and buy a nipple or pacifier that looks just like it, but it certainly is a decent tip for you guys who are having difficulty getting baby to like a pacifier. Now, that being said, I always like to warn people that if you are breastfeeding and you really want to breastfeed and you are just like breastfeeding is the best and I'm going to do nothing else, you want to wait those first few weeks to make sure that breastfeeding is well established. Because the difference in the nipples between your nipple and a synthetic pacifier type nipple can be different, or bottle nipple can be different, you do want to make sure that your baby is understanding how to properly suck and swallow while at the breast. And that usually takes a few weeks. Again, they're born with this reflex to be able to suck, but they're not, they can, just like all of us, they can develop bad habits or lazy habits. And so you want to make sure that breastfeeding is well established and that they, you're not having any, issues or things like that with latch before you kind of get this started. So I'd wait a few weeks on that. That being said, so that's to kind of prevent what they call nipple confusion. So you guys might have heard of nipple confusion before. That being said, nipple confusion isn't as common as you guys would think. Certainly babies do notice the difference between the two, but many babies can go between them without an issue. So once you do start to introduce the pacifier or you do introduce a bottle, what I would tell you, a big tip with this is introduce it, and then the next time you go to breastfeed, just make sure that you're not, if you start noticing babies having like latch issues, or they're latching on and taking a few sucks and then kind of coming off, and that's abnormal for them, or they're having more difficulty, or their feeding is taking a longer amount of time, it might be because they're experiencing nipple confusion. So if that's the case, I would either stop using the pacifier or the bottle for a little while, or maybe only use it once a day, and do it at a time when you know you're going to have a little bit of extra time to manage that feeding and to make sure that baby is still doing well, and that you can kind of re-coach them how to latch breast, at the breast, as opposed to being, at a bottle. So that's just one thing to keep in mind. Again, very rarely I would say that babies can't ultimately go between one and the other. I think the bigger thing is to just make sure that baby is being able to latch after they've tried going to a synthetic nipple. So that is, kind of just an important thing to remember. The other thing that when it comes to pacifiers, I said, remember I think Konita was saying that her baby kind of likes this pacifier, but not always, was that when babies are first born, they will be able to take the pacifier into their mouth, but then they drop it, right? They'll suck on it for a little bit and then it'll fall out. And then you're constantly, like, I don't know if y'all did this in the hospital, because I was that nurse in the hospital, and the parents were like, oh my God, this baby just won't hold on to pacifier. And parents would think that because the baby was spitting it out, that the baby didn't like it. So if that's the case and you're thinking that's the reason, it's not. It's really just that baby doesn't understand or know, or doesn't have kind of that muscle memory to keep the pacifier in their mouth and maintain it in that mouth. So there's a trick to being able to do that. And this is going to look totally ridiculous. So if y'all want to, tag your friends and have them join and watch a full-grown woman suck on a pacifier to show you this technique, feel free, do so now. So you want to go ahead, you put the pacifier into the baby's mouth. I'm going to say it first, and then I'm going to demonstrate it, and then I'm going to say it again. Okay, so you take the pacifier, you put it into the baby's mouth, and as they're sucking, you try to take it out of their mouth, but not too hard, just enough so that it triggers them to suck a little bit more. It's kind of like reverse psychology for the baby. And this, if you do this every time you put a pacifier into baby's mouth, 10, maybe 20 times, when you first put it into their mouth, it will teach them. They will then start to have that muscle memory where they will ultimately be able to, like, smile and laugh, with the pacifier still in their mouth. So it's definitely a trick to getting baby to have pacifier in their mouth. So I'm going to demonstrate this for y'all. So if you guys want to, just as we got to the good stuff, right? If anyone out there can just like, or, something to let me know that you can hear me again, would be great. So I can go ahead and keep going. And you try to pull it. You guys probably saw me like tugging. And so what baby will do is they're sucking. And if you pull, it will automatically make them start sucking more. So it's kind of pulling the pacifier a little bit out of their mouth. And you guys will be able to know this, if you've ever tried to unlatch a baby from your breast and you don't stick your finger in their mouth and pull their cheek to the side, and you just try to tug. Oh my God, ladies, that hurts, right? Like, who's with me on that? So that's kind of that same concept, that reverse psychology, where if that pacifier is in baby's mouth, you're going to kind of trick them into keep sucking on it. So, so it looks like Silvana has some latch. Baby was on a cannula. Yeah. So anyway, Silvana talking about a nasal cannula and being able to latch. So sometimes there are other things that prevent us from being able to, or baby to be able to latch well. So thanks for joining us. For those, so I see there's a few extra people joining us. So you probably are joining to watch a full-grown woman suck on a pacifier. So just one more time for you all just joining me. I'm Melissa. I'm a maternity nurse, and we're talking about why sucking is a good reflex, or is a good thing to help soothe your baby, and how to get your baby to like or to take their pacifier, because a lot of babies drop them out of their mouth. So I was saying that if you put it in baby's mouth and you kind of tug on it a little bit, it will reverse psychology, kind of trick them into sucking a little bit more. So one last time for the cheap seats in the back. And so we're pulling on it, and that's, activating their suck reflex. So, all right, now I'm done. Nobody has to watch me do that ever again. So yeah, so that's one way to really teach baby and keep keep that pacifier into baby's mouth. I know I think it's called Wubba Nubba. I'm not actually sure how you would pronounce that, but a lot of parents use that. It's like kind of like a little beanie bag type thing where you can attach, to the pacifier, and that provides a little bit of weight and can be helpful as well. But sometimes baby will still drop that pacifier. So it's super helpful if you kind of train them 10 to 20 times as you're, getting them established with the pacifier. So it's tricking them. And so even while they're sleeping, if they stop sucking, they'll often still be able to hold the pacifier in their mouth if you kind of train them well. So if anyone out there, that's kind of the first time you've learned that, I would love to know that was helpful for you guys, or you guys might be trying it later. So yeah, one of the other like kind of pacifier, besides waiting a few weeks for breastfeeding to be established before using a pacifier, I know we talked about this, that like way back in the old days, they used to use sugar inside a cloth. They still recommend these days never to dip a pacifier into anything sweet, especially any kind of honey, maple syrup, corn syrup. All of those things can actually end up leading to baby getting this really bad toxin of this bacteria called botulism, and nobody wants their baby to get botulism. So they really highly recommend never, ever, ever dipping your pacifier into anything super sweet, or anything sweet really at all. In the hospital, and only in the hospital, it's actually considered medication. So you guys know this. We do have a kind of I think it's called 24%, and it's sugar in water, and it's called sucralose, I believe is the term for it. And we actually have to get it out of the medication machine. So it's considered a medicine. So that's really the only time, if it's prescribed by a doctor or it's the nurse in the hospital and they're getting it out of, the medication machine where we keep the Percocets and the aspirins and all that kind of stuff. That's the only time that baby really should have anything sweet, because it is considered a medication. So again, never, ever, ever dip it into anything sweet, and if you dip it into brandy, I won't judge you for sure, but feel free to pour yourself a glass when you're doing that. All right. So, but most people would recommend not doing that actually for babies. So, but again, no judgment here. I'm a nurse. I've probably seen it all, and I never judge, because whatever works for one family doesn't always work for the other. So, the other thing is, make sure if you're using a pacifier, you have one of these nice long type of strings, and that you don't have anything that's really thin and kind of small like this. This little end is probably okay, but if the entire thing were that size, it's too small and it would get wrapped around baby's finger. So make sure you're watching for that as well with your pacifier. Silicone, don't use rubber. I don't even know how you'd get your hand on a rubber nipple these days. Most people are using the silicone, like a food grade silicone. And then of course, just keep your pacifiers clean, toss them into the dishwasher, hot water, soap, maybe wash them once a day, wash them if they drop on the floor, obviously. So that's kind of like just general tips on how to use a pacifier and get baby to like and take a pacifier. Now, a big thing that we want to know about with pacifiers: how do we get baby to stop using a pacifier? Because pacifiers are cute and great, and babies love to use them. And sure, older babies might need them occasionally if they're really upset or they had a nightmare or something like that. But it should be like a one-off. It should not be, most kids shouldn't need necessarily a pacifier after a certain age. And they do, at around 6 months of age, get emotionally attached to the pacifier. So it's best to try to wean your baby off the pacifier around the 4 to 5 month mark. And you just kind of wean them down. So they might be using it all day, and then you're only giving it to them for a few hours a day. And then really maybe you're only giving them to them, at that one time really late at night when you're trying to get them down to sleep and they just won't have any of it, right? So you're just slowly weaning them off of it, starting around that 4 month mark and then up until that 5 month mark. But you really want to try as best as you can to get baby off the pacifier by about 6 months, because otherwise they can get kind of emotionally attached to it. And then you might have a 2, 3, 5-year-old, 34-year-old woman. No, I'm just kidding. I don't use a pacifier. But you might end up with a kid who's still using a pacifier. And the reason why is because by 4 or 5 months of age, babies do have that better coordination, that muscle memory, and they're able to bring their hands to their mouths. So they can actually bring their hand to their mouth and keep it there if they want to. So if that's the case, and you've got a kid who might be a thumb sucker, and thumb sucking is a normal thing. You probably more people out there than will admit to it that have sucked their thumb at one time in their life, or for probably a long time in their lives. But that's the reason why you want to get away from using a pacifier. So it's not some kind of external thing that essentially the child or the baby can self-soothe, so that they're being able to use their own hands or their own finger, because now at 4 or 5 months they have that dexterity and ability to at least get their hand to their mouth and to keep it there. So that's, super important. Now, I promised you guys all, any of you breastfeeding mamas out there who wanted to avoid the pacifier, maybe some of you new moms out there who still are waiting for breastfeeding to be well established. So how to get baby to be using their sucking reflex to calm them without actually using a pacifier. And I mentioned this briefly in our overview video a few weeks ago, but I'm going to go through it again. So baby's suck reflex is actually activated by stimulating the soft part of the back of their mouth. So you guys, while you're listening to me, use your tongue and feel the roof of your mouth, feel the top of your mouth, and it's hard towards the front where your teeth are. And then as you get probably about halfway back, it's really, really soft. You can put a finger in your mouth if you want to feel it that way, but you can also feel it with your tongue. So it's that part, that soft palate, that soft part in the back of the mouth towards on the top of the back of the mouth is what stimulates a baby's sucking reflex. And so in order to stimulate their suck, you want to actually either get the pacifier. So some parents might actually put the pacifier in the mouth and kind of jiggle it around to kind of tickle that soft palate. But again, if you don't want to use a pacifier, you can actually use a finger, any finger, mom's finger, dad's finger, grandma's finger, any finger. If you want to if you want to, be super specific, like we were saying, if you're already out there looking at your own nipple and kind of comparing pacifiers on the market to what you saw at home and what your nipple looked like, you could do the same for, the finger that you use. So, mine might be like a pinky finger. Somebody else's, like if it's your husband, it would certainly probably be the pinky finger, but if it's yours, it might be the ring finger, something like that. So you can kind of, see what's the kind of the girth of the nipple, and you can use like whichever finger you think might be best. So I often, depending on the child, will either use my pinky finger, or I will actually just use my pointer finger. So you can use that, and what you do is you will stick the finger, so we've got the soft pad part, right? And then we've got the nail part, right? Everyone can see that. So this soft paddy part goes up towards the roof of their mouth, and the nail goes towards the bottom. And you just stick the finger into their mouth, and you kind of curl it up like this, and you tickle that back part of their mouth, that soft palate. And you will notice pretty much instantly, if you guys are out there listening and you've got baby close by and they're not asleep, because we never wake a sleeping baby. I'm not evil. But if you've got a baby out there, go ahead and try this. So actually, make sure your hands are clean, wash your hands with a little bit of soap, and put a finger into their mouth and tickle the top part of their mouth, and you will feel them suck. And they have quite strength to them. I've had, full-grown dads actually go, ow, that hurts after a while, especially if you've got babies sucking on your finger for quite a bit of time. So if any of you ladies out there experience any trouble with breastfeeding, or you had pain with your nipples and you want your husband to feel like why it was painful, have him try this. Put a clean finger into baby's mouth and stimulate that suck reflex, and make him keep it there for, a couple minutes, and he will admit that is not very comfortable. You're just not used to it, right? It's awkward, and not awkward, but you've just got you've got a baby sucking on like your nail bed, and there's almost like this chafing that's going on. And so, it's interesting. So for sure, if you want to kind of get back at your husband a little bit, sure, he doesn't really know what the pains of labor were like, but if he's ever complaining, well, your breastfeeding can't hurt that bad, like have him try this. So this is a great way. Again, you can use just the finger. So put it into the back of the baby's mouth and stimulate, not too far, because then you'll gag them, right? We don't want to activate their gag reflex, but just stick the finger in, again, pad part of the soft fleshy part towards the top, and then the fingernail towards the bottom, and you are just stimulating that sucking reflex, and then the baby will end up calming and soothing themselves. So that's a great tip and trick if you do not want to use a pacifier. So that's one thing out there. And yeah, so any parent, grandparent, anyone can use that finger. In the hospital, we obviously use gloves, so we washed our hands and then we put gloves on, and then I would use that as well. And that's great even for a baby who doesn't like a pacifier. So if you've tried everything, if you tried like all the pacifiers, you've tried that trick where you're kind of like faking the baby out and trying to pull the pacifier out to get them to suck on it more, and they're still not taking to the pacifier, and you want to, still use that sucking reflex as kind of like, the icing on the cake, so to speak, or, of this recipe of soothing of these 5 S's, then you can use a finger. So that's a good tip and trick for you all out there. So at this point, I would love to open it up to questions. If anyone out there has any questions out there, if you've got any questions on, like anything that I talked about, if you, I guess, if you want to see a grown woman suck on a pacifier again, you can request that again. But if there's anything out there that you guys, are wondering about when it comes to either sucking or any of the other 5 S's that we've talked about. So, swaddling we went through a few weeks ago, and we did side or stomach lying. And we're going to do swaying and shushing, in 2 weeks, I think it is. Yeah, 2 weeks time. So next week, we're actually going to have a guest on. So you guys are going to definitely want to tune in for that. She is a sleep consultant, and she's going to be discussing naps. So you guys are going to want to tune in for that one. And then we're going to restart again. We're going to do the swaying and the shushing, again, in a couple weeks time. So, all right. It looks like we have a question from Maria. Maria is asking, how do I know if my baby is hungry or just wants to suck, for like non-nutritive sucking? And that is a great question, actually, Maria. So one cool thing that a lot of people don't learn about at first when their baby is born is the rooting reflex. So if you stroke a baby's cheek, just gently stroke their cheek, if they are hungry, they will actually turn towards so if you stroke this side, they would turn this way. If you stroke this one, they would turn that way. They will actually turn towards something and open their mouth like a big yawn, and that is their rooting reflex. They are actually looking for something to eat. So if you're wondering, like, is my baby hungry, or do they just need some non-nutritive, do they just need the pacifier? You can stroke just very gently the one or the other of their cheek. And if they turn and they open their mouth in that big yawn, then they are probably hungry and it's time to feed them. If they don't, maybe they just need a pacifier. Great thing is, if you just try with a pacifier and baby doesn't like it, if baby likes it for a minute or two, and then all of a sudden is like screaming and crying again, then they are probably hungry. And then the last thing is, if you start to feed a baby, if you start to give them a bottle, or you express some milk, from your breast, or you start a little bit of breastfeeding and they come almost instantly, it's like they kind of, then they were hungry. So that's some pretty good tips to know about if you want to know if your baby is hungry, or if they are just looking for some non-nutritive sucking. Okay, so we have 2 other questions, one from Conitas and one from Lorna. So I'll get to those. I'll get to Lorna, I'll get to yours in just a second. So Conita asks, would you recommend to try a pacifier with the baby if they're already 4 months old and had never wanted one before? Honestly, at this point, probably not. Maybe if, it's a super fussy night, you're just trying to get them down and nothing else is working, you could try it for sure. But at this point, as I said, this 4 to 5 month range is when you're already wanting to wean baby off of their pacifier. So you probably don't need to, if you've got a baby who's 4 months old and never wanted one before, never wanted to use a pacifier, or you didn't know the tricks that I provided today. Or you could just try using that finger, right? You could try a clean finger, and you could see if baby likes it, if baby uses it that way. And that might just help, like I said, kind of get them over if it's ready for nap time and they're just being super fussy, and you just need something else to kind of settle them, then I would try that. But I wouldn't necessarily try a pacifier at this stage, or if I would, maybe just a little bit longer and then I'd ditch it, because you're kind of reaching that threshold where you'd want to wean baby anyway. So Great question though, for sure. All right, Lorna said, can baby get addicted to the pacifier if they always sleep with it? Great question. So babies, again, as long as they're beyond that 6 month, if they're beyond the 6 month mark, we want to wean them off the pacifiers because they can get emotionally attached or addicted, I guess is a way to put it. But I would like to reframe the concept of addiction, at least when it comes to sucking in babies, because babies are sucking for food and they're sucking in the womb for practice and for soothing all the time. So like, maybe not 24/7, but like 20 hours a day they're sucking. So if, that sounded really funny, 24 hours a day, baby's sucking. Sometimes they do suck. Sometimes they just cry and annoy you. But, so if you've got a baby and they're just born, again, probably 20 hours of their day is spent, or a fair amount of their day is spent either sucking in their sleep, practice sucking, actually feeding, anything like that. So just providing them with a pacifier, let's say all day, at that stage from newborn to like 3 or 4 months is not an addiction because baby was getting it all the time before. So if anything, I guess you could say they were already addicted to it and you're just starting the weaning process. So now maybe they're only getting the pacifier 20 hours a day, or then they're getting it like, 18. Maybe as they get older, they don't need it, during the day and they're only using it to go to bed with. So they're like 2 months old, 3 months old, and you're not using it during the day as much. So no, babies cannot get addicted to soothing or to sucking or to any of these 5 S's in any way. But it's a great question and for sure something, that parents wonder about. So, yeah. Any other questions out there that we might have? Anyone out there have any other sucking related questions? I wish I had thought of maybe printing out a diagram, but how babies suck in the how they suck on a breast versus on a pacifier, but maybe I'll do that another time. Okay, we've got a bunch of questions coming in, so give me a moment here. Let's see. Kristen is asking, should there be any concern if baby never really takes the pacifier or non-nutritive sucking as long as they're otherwise happy and healthy? No. So Konita, I think you were saying that your baby at 4 months old doesn't really like the pacifier, or you've tried it a few times and they didn't really like it. No, there's no cause for concern in any way. Certainly if you're having feeding issues, if baby is having difficulty actually eating, whether that's breastfeeding or bottle feeding, that might indicate that there's some issues with their suck swallow reflex, and that would certainly be more cause for concern. But just because baby doesn't like it, for sure there's nothing to necessarily be worried about. But I've found, I would say probably the same with swaddling, like 9 out of 10 babies do or will either take to a finger or a pacifier if done correctly. So you can offer one of those two, and most babies will enjoy that from a non-nutritive sucking perspective. So yeah, so certainly wouldn't be worried if for Konita, I would not be worried that there's something wrong with her baby just because he doesn't like sucking. Not at all. And I'm sure her pediatrician would be like, oh my God, no. Let's see. Ashley is asking, will frequently feeding my baby spoil my baby or make them have more colic? So no, actually, again, this kind of goes back to that same thing. In other, tribes in remote areas, women are putting baby to breast 100 times a day. And there's nothing wrong with those kids. There's no additional colic or tummy issues or trouble like that. Certainly if you are always giving a bottle, your baby's crying and you just want to make them stop. And instead of trying a pacifier, instead of trying a finger, and you're always just kind of giving maybe a bottle, which is easier to suck from as opposed to breastfeeding. Breastfeeding is a lot of work for baby. They have to actually do this kind of so they're kind of if this is the breast, they're kind of massaging this way. So it's this kind of full mouth, sucking, swallowing motion. But if you're always just kind of shoving a bottle in a baby's mouth, yes, they might get a little bit overweight, or, you could be overfeeding them, which could cause some tummy troubles. But for the most part, if you are trying a pacifier and the first few minutes they like it, but then they're not taking to it, then, there's nothing wrong with that. Or, if they are taking to it and enjoying the pacifier for 3 hours in between feedings, there's nothing that's going to happen with that. Babies swallow air anyway, whether they're breastfeeding or bottle feeding. They're used to that. That's why they fart and burp so much and kind of have a little bit of spit up. But actually using a pacifier, there's nothing going to increase that. So no worries there for you, Ashley, at all. Okay, let's see. All right, now Maria had another question. Does sucking on a pacifier make breastfeeding less successful or interfere with breastfeeding? So yeah, we talked about that a little bit earlier, about we want to make sure that breastfeeding is well established, to make sure that, you know, there aren't any issues, because they are different. The nipple types are different. So we would want to kind of make sure that breastfeeding is well established. And then if after we've introduced a pacifier or bottle nipple, baby has issues latching or breastfeeding, it's right after that introduction, we would want to stop using that pacifier, or maybe wait a few more weeks before introducing it. All right, we also have a question from Silvana has asked, my 4-month-old preemie baby sometimes likes to pretend suck with his blankie. Is that normal, or should I give him a pacifier instead? So because you said preemie, I'm not 100% sure if, because when babies are born early, I don't know when he or she was born, and if you mean like 4 months from their birthday, or let's say they were born 3 months early and they're only like a month away from their birthday. So it actually is important, to be honest, because preemies, you got to think in a way they age them differently at first, because they have different kind of milestones and markers. So we wouldn't expect, if a baby's born 3 months early, to end up having the same things as like a full month old. Okay, so Savannah is clarifying that her baby is really like 2 months old. So he was born 2 months early, and he's about 2 months old, and he's liking to kind of just suck on his binky, or sorry, his blanket, the corner of his blanket occasionally. And should she give him a pacifier? That answer is yes, yes, yes. It sounds like he would love a pacifier, or at least a finger. So he would really enjoy probably some kind of non-nutritive sucking, and he has found a trick around being able, instead of maybe he can't get his hands or keep his hands to his mouth, his blanket can get into his mouth. But the thing I would definitely be concerned about with a blanket, especially for a sleep setting, is if you've got a loose blanket that he's able to suck on, that could ultimately be a SIDS hazard. So I would actually definitely swap that out for a pacifier. If you want to get baby to take to the pacifier as well, if you're a breastfeeding mama or even a bottle feeding mama, what you could do, and maybe hopefully Konita is still on. If she's not, she might, we might tag her later so she can watch the last little bit of this video. You might want to take a little bit of formula or hand express some breast milk, and you can put it onto that pacifier and get baby kind of to recognize or to associate, you know, using it that way. So you're kind of, again, tricking them a little bit into getting them to take it. But definitely, Silvana, if you've got a baby who's already at around 2 months of age, essentially, or again, preemies are aged a little bit differently. So he's 2 months from when his birthday would have been. So he's emotionally and kind of physically about 2 months old. You should definitely be swapping out that blankie for a pacifier. And if you are worried or he's not taking it, again, you can try kind of tugging on it at first. Try a couple of different types of nipples. Again, go check out what your nipple looks like. Is it long? Is it fat? Is it thin? Is it short? Is it, there's all different types. And try to find one that looks on the market like an actual pacifier that looks as close to yours as possible, and then maybe dip it in, again, we never dip it in anything sweet, but if you have a bottle or you just fed baby, you could maybe dip it into a little bit of the dregs of the formula, or hand express some milk onto it and see if you can kind of trick baby, or to let baby know like this is something that's soothing, and it kind of gets them started on sucking on it, but it's not going to keep them sucking if they're actually hungry. So yeah, great question, Silvana, and good. I'm glad Konita's still here. So you heard that if she did want to try to get her 4-month-old to try the pacifier again, she could end up trying to, use some some breast milk or some formula. So, all right, we had a couple other questions. I'm just scrolling here, so I apologize if you see my finger. I'm just kind of scrolling on the screen. All right, let's see. I know you talked about swaddling with the arms down. Yes, I did in a previous video. So babies that are really young, like under 3 to 4 months, you want to swaddle with their arms down. And then she's saying, so if swaddling is so important, but they also like sucking, why not swaddle them so their hands are up? That is like, I don't know, that's like an A+ question. Great question. And a lot of people would think that. And there's 2 reasons why you wouldn't want to do that. The first is that when their hands are up like this, it makes it easier for them to break out of the swaddle. So you're going to end up with them getting out of their swaddle quicker. And you're also going to end up with that loose fabric, kind of, especially for nap time, could be dangerous from a SIDS perspective. Also, even though you've got the swaddle and they've got their hands up here, they're still under the age of like 3 or 4 months. They're not coordinated enough. So like their body is doing all sorts of crazy things and their hands are trying to flail and they're not keeping their hands right here. If any of you have watched a baby, even if you swaddle them with their hands here, their hands might be here for like 2 minutes, maybe 5, and then they're moving enough where like they still can't coordinate and they're like smacking themselves in the face with their hands and they just can't keep their hands up there. So that being said, it's like torturing. It's not really like torturing a kid, but it's like, you know, it's like offering what they want, but then not like, it's not really within their reach or something that they can have. And that's like, So don't actually, it's actually best not to have their hands up like this and offer a pacifier instead, or a finger would be a better solution for that particular scenario, instead of kind of keeping their hands out. So you can keep that keep the swaddle nice and tight, and then you can provide something else for their, you know, their non-nutritive sucking. Again, once baby gets to be 3, 4, 5 months of age, they do have the ability oftentimes to get their hand to their mouth, or to at least hold their hand to their mouth. And that's when we're going to start weaning off swaddling anyway. And if that's the case, you can start swaddling with one hand out. So yeah, that's a great question for sure. Let's see. Alexandra has a question. If I let my baby suck at my breast all night and I'm asleep, but it's super cozy, is there anything harmful in doing this? So I will just say kind of what everyone says, right? Because SIDS is a real risk and a real thing. So if you are going to be allowing baby to suckle at the breast kind of all night long, make sure you do it safely. Make sure you have an environment that is good for SIDS, that it doesn't have any loose blankets or pillows. So that means mama can't use pillows, mama can't use blankets, you know, that you don't have a lot of extra clothing, nothing, you know, you're keeping baby away from cracks. Like if you have a mattress where there's 2 mattresses shoved together, that baby's really far away from that, or they're far away from the headboard. So they're not going to be able to get into any kind of danger with that. There are tons these days of co-sleepers on the market. Maybe the DockATot, things like that. So that's something to try, or you could use one of those bassinets that's super close by. But if you're putting the baby to breast 100 times a day, good for you. Like that's great. Even if it's through the night, there's nothing wrong with that. Again, just be cautious of that safe sleep precautions for SIDS in a SIDS setting. So just make sure of that. But otherwise, no, there's nothing wrong with it. You know, you're good on you that you can, you know, sleep through that. Some mamas like are up to breastfeed and then they're like, baby, go to bed, because mama's got to get back to sleep. Some women don't find kind of those, like if you had 5 middle of the night feedings to be terribly soothing for mom, or you're not getting a ton of rest. So just keep that in mind. Anytime you are kind of letting baby kind of suckle all night, instead of using a pacifier maybe for the non-nutritive sucking, you want to make sure that you're able to sleep or to get some rest. And that's a challenge, obviously, kind of keeping in consideration all the different SIDS things I just mentioned, as well as that. So great question, but no, nothing wrong with you at all. And I think that about wraps up the questions. I'll give you all about another minute or 2 if there's any other questions out there about sucking, pacifiers, the trick of breastfeeding questions, if you have any out there. But every week, every Thursday at noon, we're going to be having a different topic. And soon we're going to be asking you what topics you want to hear from us. So please share, you know, what you might want to you know, what you might want to be able to learn about from me as a nurse. We're also going to be getting some guests on occasionally. So if you have anything in particular, any particular guests that you want, a doctor, a pediatrician, let us know what you're thinking of. But next week, I'm actually going to be on vacation. I know it's like my first vacation in forever. So we're going to have a guest on, and we are going to have on Brooke Nale. I hope I'm saying that right. But I met Brooke several months ago, I believe, at a trade show out in, it was like a baby show out in California. And Brooke is a sleep consultant. She has a business called Sleepy on the Hudson. And she is going to be joining us next week, and she's going to be talking all about naps and nap routines and schedules and nap training and sleep training. So that is super helpful. I'm sure so many of you guys will know or have questions on that, or have a baby who has trouble sleeping. So be sure to tune in next week at noontime and tag your friends and tell them that what's happening. But every Thursday at noon, we're going to be going over different topics. And next week is a sleep consultant, Brooke, and she's going to be talking talking all about naps and sleep training. So super psyched to have her on while I am on vacay. And then the following week when I am back, we're going to be finishing up these 5 S's, and we're going to have live demos. So we're going to have actual babies, and I'm going to do swaddling again, but mainly we're going to be focusing on constant motion, swaying, and the shushing. So I hope you guys are able to tune in for that. Yeah, and I believe we had one last question come in here. Can pacifiers cause ear infections? So that's a great question. Actually, there have been a few studies that have shown that kids who use pacifiers may have a greater risk for ear infections, but it's nothing that is, you know, like dangerous for kids. It's nothing that you should like avoid using a pacifier for, especially if you're using it for non-nutritive sucking and you've got a super colicky baby. And I think the reason why, I don't know, I didn't read that full study, so I would have to certainly read that and what age they're talking about. But most babies under 4 months don't get ear infections, period, end of story, at all. And so if you're weaning your kid off a pacifier by about 6 months, chances of them getting an ear infection from a pacifier are probably slim, just because babies, usually don't get ear infections that early. They might get a cold, they might get the sniffles, but they usually don't get ear infections. It's rare, let me put it that way, if they do. And then also, the reason, this is just speculative because I don't know if they've actually done the research within that study or any additional research, but the thought might be that pacifiers or sucking can cause baby to suck so hard that they're kind of messing with the pressure in their ears. But babies, yes, they can suck hard, but they were like built to do this. So I don't really think, and I've met plenty of doctors who, you know, really don't, they would never say don't use a pacifier or don't use, you know, non-nutritive sucking just to prevent ear infections. So maybe you'll have a higher risk, but I really think that that's more for the older kiddos, the 6 month and plus, who are using the pacifier and probably shouldn't be. And I bet if they did a study on thumb sucking and ear infections, they might find the same findings. So I really wouldn't be terribly concerned about it, but it is a great question for sure. And if you have any questions, of course, you know, you can always talk to your pediatrician, or you can leave them additionally in the comments here. So we do check the comments occasionally, even after the video. So if you're tuning in after we've shot this live video, you can still ask questions and we will get back to you on those. So I think that's it for today. Again, next week, noontime, we're going to have Brooke, who's a sleep consultant, on. So bring all of your questions related to sleep training, you know, and sleep schedules, and Brooke is going to answer them for you. So next week at noon, tune in for that. And thank you guys again for joining me. And have a great afternoon, everyone. Bye.